Everyone.
Hi.
Just to let you know, I'm going to be recording the webinar today just so that we can share it after the session with people that might not have been able to attend. And apologies, I'm not able to use my video today. I'm having problems with the connection, so I thought I'd best leave it off just to make sure that the rest of the session hopefully goes okay and we don't get any internet issues. Muz is on the call, so Muz is going to be sort of delivering the session today.
Hi.
So yeah, I will hand over to Muz if that's okay.
That's fine. I am just gonna make a start. I'll start by sharing my screen and getting the slides up. Hopefully that's loaded.
Yeah, I can see that.
So, yep, thanks everyone for joining this webinar today. My name is Muzamil.khan and I'm the commissioning officer working within the public health team at Oldham Council. Excited to be here today to present an overview of the Connect 5 training program and look at how it contributes to improving mental health and well-being across our communities in Oldham, and also look at some of the plans for cascading Connect 5 across the borough. So what is Connect 5 and how can it help us within our practice? Connect 5 is a mental health promotion training program which is based on the latest evidence-based. It is designed to increase the skills and confidence of frontline staff, including non-mental health staff and volunteers, to be better equipped in having open and effective conversations around mental health and well-being. The training uses cognitive behavioral tools and techniques to support people to apply them in their personal and professional lives. This empowers them to think about some of the life challenges and what they might do to help themselves and also others who they may come across within their everyday practice. The training also underpins the 5 ways to well-being, which are connect, be active, take notice, keep learning, and give. All of these steps promote actions to help us to maintain and improve good health and well-being. This is a positive tool that can be used to frame conversations around how someone is feeling or getting on. So let's look at some of the Connect 5 sessions. So Connect 5 consists of 3 sessions. All the sessions are interactive, encouraging participation and open discussion on how to have a conversation and what to do in a situation if someone opens up about personal issues that might be impacting on their emotional health. The sessions build on the principles of every contact counts. This supports the aim of making the best use of skills and local contacts. So session 1 is a brief mental health well-being advice session. This is an intro session to Connect 5. It aims to help participants to better understand what mental health is and how we all have it. This session is for anyone who wants to improve their mental well-being and also learn about local services, resources, whilst looking at how to support others by offering general well-being advice within their everyday practice. Session 2 is brief mental well-being interventions. This builds on session 1 and is more focused around talking to someone and having them to express their thoughts and feelings about situations that are affecting them in a safe space. The session also covers brief information around suicide intervention, making you aware of how to approach a conversation with someone who may be expressing suicidal thoughts. And then finally, session 3, this is extended mental well-being interventions. This session is more in-depth, which provides a comprehensive insight into the practical tools to enable you to motivate and support someone manage their mental well-being and make changes that last. All the sessions would need to be taken in sequence, starting from session 1 before progressing to session 2 and then session 3. Each session consists of key distinctive characters with different scenarios to enable you to apply the tools to support an individual or overcome certain challenges that they may be faced with, and also looking at how to challenge some of the stigma around mental health. The sessions are flexible, can be delivered online or in person, depending on what would be appropriate for the group or organization. So this slide is just an overview of some of the benefits around the Connect 5 training. So understand the tools and techniques to enable you to improve your mental health and well-being through different public mental health models, for example, the 5 ways to well-being. Learn how to support someone struggling with mental health issues by practicing a wide range of different interventions. Promotes open conversations around mental health and well-being, which builds a supportive and compassionate work environment. Develops key skills needed to talk to someone about mental health and well-being, and also learning how to hold these types of conversations. Also learning about local services, self-help resources available to manage mental health problems, so you are better equipped to signpost them with confidence. The training also contributes to increasing resilience and mental well-being through positive changes. This takes the position that we don't need to be a mental health specialist to support those going through emotional distress. Ultimately, the training gives you the key skills that are not only essential for professional but personal life in general. These skills will support you in your roles to support clients, residents who may be struggling with their mental health. There's also a wide range of other public mental health benefits from the training program. So here are some of our plans for the Connect 5 Cascade program in Oldham. So in partnership with Action Together, as part of developing the Connect 5 program, we aim to support new and existing trainers to deliver the sessions within communities across the borough, to give people the opportunity to attend and not only have the awareness, but understanding around what mental health is and how they can support someone who may be struggling within their practice. As part of the plans, we intend to support trainers to become better equipped and confident to deliver the training sessions. And this will be done by building on the existing network of community of practice that had previously been developed by the Big Life Group. And there will be opportunities to attend, reflect and refresher sessions for trainers to share best practice and support each other. And some exciting news, there will also be a micro grant offer available for existing and new trainers to apply for funding to support with associated training costs to deliver sessions across the VCFSE sector. This is following a successful bid with Greater Manchester Integrated Care Partnership to develop the Connect 5 locality programme for Oldham. Let's look at some of the outcomes. So in terms of the outcomes, there'll be enhanced access to Connect 5, which this will increase opportunities for sessions across the VCSE sector. The programme will aim to increase normalisation by changing the way we have conversations about mental health and well-being, which is extremely vital now considering some of the mental health impacts from the COVID-19 pandemic, but most importantly, the cost of living crisis. The training will also be beneficial to a wide range of staff working across different roles. The training would support them to become more competent in their role to deliver better health outcomes within their practice, in particular addressing some of the stigma around mental health. So how you can get involved. So there's a number of ways you can get involved. Attend Connect 5 sessions when they become available. Keep a lookout on social media and Action Together's website for regular updates. And also encourage staff members that you work with within your organization to attend some of the sessions when they become available. You can also look at becoming a Connect 5 trainer. So recently Togmine trained the trainer sessions, and there may be possibly more opportunities coming up in the near future Once again, the information will be available online with regular updates on social media. And finally, if you are an existing or new Connect 5 trainer, then I strongly encourage you to attend Community of Practice workshops, which will be taking place once a month. We will be inviting all the Connect 5 trainers to an introduction meeting in the around next month. So we can connect with them all and look at how we can support them as part of this program. This slide just contains some helpful resources, support services and links available. So on the left-hand section, we've got some of the local support. We've got Oldham Council's We Can Help web link, where there's access to a wide range of services. We've also got some of the mental health services, such as the Pennine Urgent Mental Health Helpline, the Tog Mine as well on Union Street, and then Andy's Man Club to support. It's a men's talking group which takes place every Monday evening. The middle hand section has a wide range of digital mental health platforms available for Oldham residents to access some support online, such as Together All online platform. We've got the COOF and Quell, and then these are some of the online resources, such as the Greater Manchester Help Hub, the Shine a Light on Suicide, and then the section on the right just contains some of the national helpers around suicide prevention, such as Papyrus, the Samaritans. So some useful links there to share. Thank you for attending the session, and if you'd like to find out more about the Connect 5 program, then feel free to contact me. My details are on this slide. And now I'll open the space for any questions or further discussions. So does anyone have any thoughts or reflections in terms of the program?
Yeah, so how do you envisage referrals coming through, and what's the length of the sessions that people might attend?
So the sessions vary. In terms of kind of the initial Connect 5 session, the introduction one, it's a 3-hour session. It can be delivered online. So in terms of kind of referrals, it's more kind of, I would say it's ideally aimed at staff members. And in terms of kind of signposting them, we're looking at supporting the Connect 5 trainers in Oldham as part of the program. And then the training opportunities will be out there to staff working across VCFSE sector, so people can join them when they become available. So it's mainly looking at when they become available, and then looking at how to signpost staff members within your team or organization or group.
Thank you.
Thanks. Has anyone else got any other questions or would like to find out more about some of the sessions or the program in general?
I haven't got a question, but I just would like to say Assalamu alaikum. It's Rubina Muzamil.
Hi,
We worked
Rubina.
at Alexandra Park. You okay?
Yeah, good, thanks. Yeah,
Just
nice to see
recognise
you.
you,
Yeah,
yeah.
it's been a while. Yeah,
Yeah.
I hope everything's okay with
Me and
yourself.
Deborah on the same social subscribing with social subscribing link workers for West PCN.
Brilliant.
Yeah, so I have done some of the Connect 5 a year ago in Rochdale, a year and a half ago. But I mean, obviously know the concepts and all that, but it's really good program, like getting trained up and delivering that to our clients then.
That's brilliant, that, Rubina. So can I ask, are you a Connect 5 trainer then?
I've delivered them in Urdu because I trained myself up first, and then I delivered them in Urdu for people with dementia in Rochdale. Actually, that was before Talk Minds a couple of years ago, after, you know, when I left Alexandra Park.
Yeah.
So I did that for like for about 6 months. So I did
Sure.
about 8 groups. So I don't mind. I mean, obviously refreshing again, going through it.
Brilliant. So what we'll do is then when we set up the intro meeting, I'll send you an invite, and then if you're available to join, then feel free to come and attend.
Yeah, they're really good. Yeah.
Yeah.
We have delivered quite a few sessions in Rochdale, and you know, it does make a difference to people.
Brilliant. No, thank you. Thanks for the positive feedback.
Yeah.
I wondered kind of how long the commitment might be, because obviously it fits really well with what we do, engaging with people, and there's a lot of, well, an awful lot of people get referred to us who need support around the mental health and well-being, and we refer out to like Tog Mind, but also just having those conversations and helping signpost them in the right direction. So it'd be really sort of a useful fit with what we do. But I wondered, you know, what's the commitment? Like you were saying, there's monthly sessions. If someone was trained up with Connect 5, might they be expected to attend a certain amount of times? I'm just thinking about what the ask would be from us.
I guess in terms of kind of the monthly community of practice session, it's more kind of looking at how we can then support the trainers. So there would be trainers that are able to deliver Connect 5 and have delivered it in the past who have got quite a lot of experience. But at the same time, we recognize that there'll be people that might be new to it, to Connect 5, and they might not have delivered any sessions in the past. So it's more kind of looking at how we can support the Connect 5 trainers that we have to be able to deliver the sessions across communities in Oldham, so that they can become confident, and also to look at how we can support them in doing so.
So are you looking, if we are coming across people that we feel could have like lived experience and be competent to engage with people, are you looking for us to potentially consider them, you know, or refer them to you as a potential trainer as well?
I think, yeah, so once we've got the kind of Connect 5 program set up in partnership with Action Together, we've got the trainers then who are looking to deliver the sessions, then yeah, I guess as a kind of, unless you can deliver sessions as well as a Connect 5 trainer, if you've been trained to deliver it, then it's more kind of looking at getting them possibly on the program and understanding what mental health is through the kind of module 1 element of it.
Can I just say something, just to elaborate on that, Deborah? I understand what you're saying, Deborah. I think for us, it'll be a bit impossible to deliver this further on. We can get trained, and we're already doing a lot of this in our work currently, Deborah. But what is, as Muz is saying, when it gets a bit expanded, the structured program, what we can do wherever these Connect 5 programs trainers will be training or delivering the training, we can refer our clients into that, so they can have like learn about the Connect 5.
That's correct,
for example, like we're already engaging people into getting active. We're already trying to say to people, encouraging them to do volunteering. You know, that's part of the giving, and noticing, like having a walk. We're doing all that with the people, but it's actually acknowledging and realizing what we're doing already in our work, and then can refer into people into them training, you know, wherever it's delivered.
That's correct, yeah. So again, we might have a group we might have a trainer that might be training to a group at the likes of the Neon,
like the
Centre
community centre or any
or a community centre. So once those sessions are being promoted via the trainer, via Action Together website and social media, then it's just about a matter of kind of signposting people that you'd feel would be appropriate to attend those particular sessions.
Right. I'm with you.
And I guess
it's really positive. We've done them, and they are really good sessions actually for people. You know what we're trying to realize people sometimes taking that 5 minutes walk. So it's really good training for them to realize on these 5 things.
Yeah, and I guess the kind of whole aim behind it is to just make sure that people are confident in having those conversations. They understand what mental health is, and just to open up those conversations in general as well, because we know how obviously important this is, and you know, mental health it's a real problem as well. So this is a really good foundation to have those, to start getting those conversations opened up within different communities, and to support people as much as we can through this program.
It's really sort of about empowering sort of the workforce, really, just to have those open, honest conversations, and for them to feel confident sort of speaking with people about the mental health. You know, it doesn't just have to be mental health professionals that have those conversations. It can be sort of frontline workers in sort of all aspects of the roles. And I think pushing as well sort of within organisations that you work with, that volunteers are able to access the training too. So it's a good resource for volunteers to be able to use. And as Muz was saying, I think sort of mental health is going to be so crucial that we're supporting people with the mental health in the right way as we're getting into winter and everything with sort of the cost of living crisis and how that's impacting people. So yeah, I think if sort of you as staff members feel that you'd benefit from sort of accessing training, that's great, but also sort of just getting the word out with the organisations that you work with that, you know, sort of that training is available if they need it. So yeah.
It's a really good encouraging program. I'm just really was thinking about is it after like nearly 2 years, because it was quite active in Rochdale 2 years ago, and you know it's come a bit late in Oldham.
Yeah, I mean, we have had it in Oldham. We've been quite some time now, and I guess kind of the pandemic hit, and it you know, it had a massive impact on people being able to deliver sessions. There were trainers in Oldham that did continue to deliver some of the sessions online. But obviously now we're trying to get it back out there, you know, open those conversations up more.
It's really positive. It'll be really good for our clients, I know, that we can like refer to these training sessions.
That's amazing. That would be really helpful in terms of the Cascade program, and we will look to invite you as well to these intro meetings. The next intro meeting is we're looking at getting something set up in October to invite all trainers, so we can start to get the ball rolling again in Oldham.
Great stuff. Yeah,
brilliant. So I think has anyone got any other questions? If not, we can probably leave it as that and then get the meeting set up for trainers and for yourselves to attend as well.
We'll me and Deborah will feed back in our group as well, and to our meeting, and then maybe, because I think everyone's got this information, haven't they, Deborah?
Yes. Yeah, it was sent round. Yeah,
so we're probably going to bring it up our next Tuesday meeting, and other people can sign up from other areas as well.
That'll be great.
So I guess just sort of as we close, the main sort of ask would be sort of circulate back sort of within your own teams, and sort of get in touch with Muz if you're interested in either sort of your teams receiving the training, sort of the actual Connect 5 program, or if you're interested in becoming sort of a trainer as well. So there's two sort of separate aspects to that, and me and Muz can sort of work together just to sort of collate that information and then hopefully get started with the project. I think it's a really exciting one, and hopefully will sort of be really beneficial across Oldham. So thank you everyone for attending.
Thank you.
Thanks.
Thanks Muz for delivering it. Thank you.
Thank you for attending, and nice to see you all.
Yeah, and you too. Nice to see you.
See you, Deborah, later. Bye.
Yeah,
Bye
see you later.
everyone. Thanks, Muz.
Bye.
Bye.